So yeah, I think the biggest thing for me and the reason why I keep doing it is that I love being an advocate for women. And I love getting to provide high quality care for women. And we treat men, and we treat all genders, in our clinic too, but the majority of our clientele are women.
Welcome to Mom Meets World, a podcast talking all things motherhood, friendships, and life. We're your hosts, Elena Brookmeyer
and Peyton Saraiva. We have a lot of ground to cover, so let's dive right in.
All right. Hey, y'all.
Hey, guys. How's it going?
Welcome back to another episode. We have a freaking amazing episode today with you guys. Peyton and I actually just hung up with our guest that you're about to listen to. She is Kyle, and she is actually the owner of a pelvic health studio in Monterey, California. So we talk all things pelvic health, and like not even just pelvic health, because at least for me, what comes to mind is Kegel. So she actually advises against those, and you'll find out why, which is mind-blowing. So we talk sex things, lube, like you name it. So anything in that realm, weightlifting, which is my cup of tea. So we just had a really good organic time with her. What do you think, Peyton?
Oh, it was wonderful. I was so thankful for that chat. Kyle and I have been friends for over 10, 15 years now, and it was so great to see her in person, have a chat with her, and she really gets to explain all of her experience with how she got into pelvic floor health and how she prioritizes women, advocating for women, and just how healthcare is so important for us mamas, but also just people in general. Sex, pelvic floor health. I mean, it covers a lot, and we only were on the chat with her for about 40 minutes, so buckle up. Chat was great. Excited for you guys to hear it. But Alina, how are you? What's been happening in your life? What's going on with you?
First things first. Yeah. Just momming, like full swing momming, just keeping busy with little Chloe girl. As we always say, every day is different, especially as a stay-at-home mom. So just keeping up with her and doing our usual like gymnastics and swim class. And, her big girl swim class, she's still killing it with me on the outside of the glass, sitting and watching, and she's in the pool with the teacher and all the kiddos. So that's been really fun and special to watch. And another thing is like we all love our little self-care things. So I just got my hair did. I got my hair cut, which is great. And just, you just feel so fresh after a cut or a dye or just like any little attention in that space, especially when your hairstylist is a friend. So it makes it extra special. So left that treat for myself. What about you recently? What's been going on?
Oh, you know what? Quality time with friends has been a really big one.
Good.
I just am loving having people come to the house, and we've had a couple adult sleepovers, for example, friends just coming into town and staying a couple nights with us. Just came off my birthday party, and just the quality time with the people around us. My cup is filled. I feel, I definitely have the longing for my friends in Arizona, but I look around and I'm thankful for the community and the tribe that we have built down here in under 9 months, and it's crazy. I'm also 1 month away from being at my anniversary. My 1-year wedding anniversary is October 12th, so that's coming up so quick. And it's so crazy to reflect back that we've been in Australia over 9 months now, and just reflecting and enjoying that and soaking in all of the people around us has just been great. Cooper's at a really fun phase at the moment, talking like crazy, super independent. Funny story. So in Australia, there's a bird and it's called a magpie, and they're black and white, and they are carnivores. So they eat typically like worms or meat, or they'll eat roadkill. But in the spring, they swoop. And so if you ever see the memes online of people with bike helmets on and they put spikes in the top, it's because magpies go and swoop. Cooper has now, they're nasty, dude. And Cooper has now been swooped twice by magpies, and they will go down and they swoop you. And when I say swoop, they dive down and they prick you with their beaks on your skin or your head, and they'll like cut your skin. They're vicious, dude. And
I hate birds. Stop it. That's
I know,
so
dude.
gross.
I know. And these little bitches are not okay. So I have a bone to pick. There is a nest nearby the park that we go to, and there's a magpie that will swoop the kids. And I have been down there And I'm watching kids get taken out. I mean, blood. You see people with the
Ew.
sticks trying to hit these birds, dude, and I am not a fan. And Mr. Cooper has been a victim of this magpie, so
Does he
got his
freak out?
oh, it's kind of game over. I mean, naturally, it's scary, and Chase and I
Mhm.
have to be calm when it happens to be like, it's okay, bye-bye, and like we kind of obviously it's a little bit more heightened in the moment, but try not to scare him. But today we went tried to go to the park, and Cooper's like, no, mama, no, mama, bird, and he like knows, and it's so sad because
That's terrible.
it's not good. So I have a bone to pick with these freaking magpies, man.
In
They look
Australia, they should have like not necessarily bike helmets, but like magpie helmets,
they
like for
do.
people just to, oh my God, that's terrible that that's even a thing.
I'll
Ew.
send I'll send you guys a picture, but like it's a helmet and they put like sticks or like spikes on them and people will wear them around and it's something where like you have to
Yeah.
watch where you're walking because if you see a nest, there's one around, they'll swoop you. So anyways, that's it sounds dramatic, but it is dramatic and there's been blood. My friend Kitty, her
Mm-mm.
daughter had blood on her face from it. My other friend Elle had 2 poke marks. Her little kid Rennie is like 22 months, a big cut there and a cut on his face from the same
Wow.
magpie. Little dicks, I tell you.
And well, because they're animals too. That's what freaks me out too. It's just like sometimes, like I just associate birds with like disease for some reason. Maybe it's
Oh,
because I grew up in the city, right? Like the Bay Area, especially San Francisco, there's pigeons everywhere. They're hobbling around and just being gross and like
eh.
diseased. And so I just think like when they break skin, I'm like, oh my God, like pour some peroxide on that immediately. And like, I don't know. Mm-mm. No, thank you.
Yeah.
Well,
So
sending safe vibes for you and the family.
excited for the conversation with Kyle. So I don't want to like to tear too far off that because that's a lot more juicy than our scary magpie stories. So I think we should jump into that.
Yes, yes. All right, well, let's do it. Let's dive in.
Hey guys, welcome to another episode. We are so excited to have a beautiful guest on our show today and a longtime friend of mine. Her name is Kyle Hartman, and I'm just so excited to have this opportunity to have a chat with her. Kyle is a University of Central Arkansas graduate who studied Doctor of Physical Therapy at Samuel Merritt University. She is currently a Doctor of Physical Therapy and owns a specialty clinic of pelvic health located and practicing in Monterey since 2018. She's a gender inclusive, trauma informed, and LGBTQIA and friendly therapist, and the owner of Monterey Pelvic Health. Welcome to the show, Kyle.
Hey, it's good to hear from you. I'm excited to do this. Thanks for having me on.
Yeah, so
Yeah,
excited to have
welcome.
you. Oh, so excited to have you on. It's been quite a long time, I think, since we have like been able to chat in the flesh, but I kind of feel like it just flows so naturally, and it's good to see you and fill us in. What's happening with you? Tell us a little bit about yourself. Share a little bit about the life of Kyle Hartman.
Yeah, for sure. So, man, I feel like if we're not, I think like so much since I've seen you. But yeah, I moved out to California for grad school. And once I finished that degree, then I moved a couple hours south to Monterey. Monterey is kind of known for its like Pebble Beach golf course and the AT&T Pro Am, and like for like the gearheads, there's like a car show every year. So that's kind of what we're known for.
And
And
the aquarium,
oh, and the aquarium,
of
yes,
course.
aquarium. Like as we're speaking, I am like looking out over the whole bay from my
Mhm.
bedroom. It's like it's stupid. It's so beautiful.
Awesome.
But yeah, I've been here for 6 years. Yeah, and then started Monterey Pelvic Health in June of 2020.
Oh,
Perfect for me.
yeah.
But eventually have gotten to a point where, including myself, we have 3 clinicians, and we all specialize in pelvic floor concerns and perinatal concerns. And so, yeah, that's pretty much like the gist of it as far as like personal stuff. My partner is also named Kyle, um, which is super fun. And we just got a dog a couple months ago. She is now 4 months. She's a little golden retriever, and her name is Waffles.
Oh my God,
Oh,
so
waffles.
cute.
She's like
I
the
love
cutest.
it. God, that's so,
Your little
so
fam.
cute. Oh,
It
she's like
is,
your little
yeah, and
baby.
she's like such a cuddle bug, and it's so great.
Oh, that's so great. Oh, I've seen some pictures of her. She is so cute.
She's a little blockhead.
Oh, that's the best. I have a pit bull at home and he's kind of the same deal. Like he's a snuggle bug, even though he'll bark your head off like at a mail person or Amazon dropping off the package. But like he's not that scary, I promise. He's snuggling with me right now. But I have a question about you and your partner Kyle because like let's say you're all getting together with friends. How do you guys have like nicknames? I'm so curious.
Yeah, it depends on like the crew. So when it's like my crew, especially like out here, because he's actually from Arkansas and we were like a U-Haul couple and he moved out here. Uh, gosh, now a year and a half now. But like when he's with my friends, it'll be like Kyle 1, Kyle 2. So he's Kyle 2. And then the roles reversed when we go to Arkansas and see his friends. Um,
That's funny.
my volleyball crew will call him Guile. Which is
Yes.
clever. Yeah. What's funny is that he also, so we work together. He works at the office with me. And a lot of our patients who like aren't familiar with us or like haven't looked on our website or anything are really confused because he'll hear this like he has a really low voice. He's like 6'5", like big guy, and like, has this like voice for radio. It's like super low. And he'll be like, "Welcome to my Pelvic style." And you're like, I think you called the wrong, like, no, you didn't call the wrong number. There's another Kyle on her.
Yeah.
It's just, so it's kind of funny. But yeah, so we do like have some nicknames, but like our like friends and family, like if I am referring to him, I'm obviously saying Kyle and like they're comfortable with it. But like people who haven't really been around me, they're like, "Are you talking to yourself in like third person?" And I'm like, "No, no, no."
That's awesome.
That would be so funny. Oh my God. That's really cool that he works with you.
Yes, it is. It's really good. It allows us like so much flexibility. Like it was probably the only reason we were able to get a dog because he was able to like just focus on her while she was like needing to pee every 30 minutes.
Yeah.
Yeah, because we got her at only 8 weeks old. She was like baby.
Oh.
And
Mm.
so yeah, it's been really challenging in other ways though. Like when we first met, he was like, "You give off such like golden retriever vibes. Like you're so sweet and like happy and like just go lucky." And then he saw me at work and he was like, "I retract that statement." Very like on. Can I curse? Is it okay
Yeah,
if I
yeah,
curse?
yeah. All
Go for
good.
it.
You're very on your shit, like bitch, like you don't fuck around. So
You
it's
mean business.
yeah, like I just like when I'm at work, like I'm at work, I'm like all focused on patients, like making sure shit gets done. And then when I'm home, like yeah, I can be like kind of like Peyton, like you've known me, like when I played volleyball and stuff, like I was a
Fun
total
and goofy and like spaz, like just like fun always. It's just one of my favorite memories of you always dancing around and
but
you're just
also
like a
like
good time.
competitive, right? Like I was ultra competitive. And then I
So
get off
competitive.
and just be like, yeah, what's up? Like I
That's
could just like
that's
chill out. And so I feel like that's always like helped me. Like I can kind of like the same way like you get on the court and like you leave everything at the door and like you just like focus on your sport. Like it's the same thing at work. Like I just like focus and make sure I'm doing everything I can for my patients and everything I can for the business. And then I can get home and slowly start to unwind and be more of my happy-go-lucky self.
Makes
exactly. Well,
sense.
well, with that being said, how did you get into pelvic floor health? How did you kind of get into this line of work? What really drove you to pursue this career?
For sure. Yeah, it definitely wasn't the original thought. Like I've had like probably like three different tracks since I went to PT school. I mean, like being a Division One athlete, it was very much like, yeah, I'm gonna work with athletes. Like duh, like that's like my bread and butter. But I got to school and I was like, that's really boring. That's like working with like basically like two different diagnoses, like rotator cuff repairs and ACL repairs, and like I want to do more. I want to be like a little bit more creative and things like that. And like now I'm starting to actually get into more of like an athletic lens through a pelvic floor lens, like helping
Yeah.
people to sport after having a baby. Like
Mm.
job would be to work with like a professional athlete who just had a baby. Like our like former teammate, like
Betsy.
Betsy. Yeah, I go, I would have died. Like it would have been amazing to like get to work with her. And she's such an amazing inspiration of like having, I think she's now 4 or about to be. Um,
Yeah.
and like playing at the top of her game and like the top of the country. Like it's just incredible what she's
Mm.
done. Um,
She's coming
yeah.
on our episode in a couple weeks. I'm so excited to interview her.
It's gonna be awesome.
Yeah,
So
feel so
excited.
lucky.
But yeah, so I started with like the thought of like going into athletes and then thought that was like not really for me. And then out of school, I went into pediatrics,
Oh, nice.
which was like super fun, but also just really hard.
Yeah.
Um, because like when you're in a treatment session, you're talking about like, you're like working with the patient itself, which is like could range anywhere between like 3 months to like 16, right? And then if the parent's there, you're like having to like educate the parent and talk to the parent.
Mm,
So like having to put on your PT brain. And then you also have to be like fun, bubbly, playful to like engage the kid in doing whatever you want them to do.
Yeah.
So it was just like a lot. And when I was working in pediatrics, the moms would be like, hey, I'm dealing with like some pain. I have some leakage. Like I'm like having some issues. Like, do you know anyone who like you can send me to? And I'd be like, no. I mean, there's
mm,
what Monterey is really interesting. Like it's a very affluent area,
yeah.
but we live in like a little bit of like a healthcare desert. Like we have a like county hospital. We have like two small community hospitals, but they don't have like trauma centers. Their ER is not super great. Like if there's like a pediatric emergency, they basically like send them up to the Bay Area. And so there's just not a ton of medical resources here. Um, especially when you get like really super highly specialized like what we do. And so I started looking into it and there's like these series of courses called like Herman and Wallace. And so I started taking a course with a friend of mine who I now eventually hired, which is kind of funny.
Nice.
But we like took this course and it was just like all about women's health and like pelvic floor and all this kind of stuff. And we both just like had this light bulb and we were like, this is my circus. These are my monkeys. Like this is exactly what I wanted to do. Like I like used to be a dietetic tech and like I have a nutrition degree and a PT degree and it
Nice.
allowed me to like utilize both within my practice and allows me just to like really have a holistic practice as opposed to like just thinking about the muscles and bones and ligaments type of thing.
Mm-hmm.
So yeah, I think the biggest thing for me and the reason why I keep doing it is that I love being an advocate for women. And I love getting to provide high quality care for women. And we treat men, and we treat all genders, in our clinic too, but the majority of our clientele are women. And just to be able to help them advocate for the healthcare that they so long have deserved, and to not be dismissed or not listened to about their concerns and being able to actually like sit and yeah, just be present with them.
I feel like that's huge, especially being like women ourselves, just like not getting the attention that sometimes we deserve, or like we don't even know that we're not getting that attention or education sometimes. And so, like, even becoming a mom myself, like, prior to even being pregnant, I had no idea about pelvic health or anything like that. And I didn't realize it was going to be potentially an issue for me or that it's something that you have to recover from, especially throughout, that big chapter of my life. So it's just like one of those things where it's so good, especially since you're saying you're in a healthcare desert, because everyone needs that kind of attention everywhere. So I'm sure you're helping a lot of people.
Yeah, and
Yeah, I mean, sorry, to be the
no, go
interrupt.
ahead. No, you
Uh,
go for it.
no, it's just like it's really cool to like my favorite types of stories are patients who have come to me because they just got married and they haven't been able to have sex because it's been so painful and they really want
Mm,
a kid. But they can't start their family because they can't have sex. And so we like work through that and then they start to see an improvement. They start to even like enjoy it. And then they come in to see me a year later because they're like 7 months pregnant and I get to help them like prepare for labor and then help them through the postpartum period. So like those are the coolest stories. And that like we get to like help people start their families and help people like do so much more than just like my toe doesn't hurt when I run 5 miles.
you're making a huge impact. Yes, that's awesome.
Well, and that kind of leads us into the question of like, what are ways that you guys prepare or any exercises that you give to moms to be or people that are starting that journey of, potentially motherhood? Like, this is exactly like a gateway from, you can even start with like, how do you teach people to have good intimacy and like what sex looks like for someone that's got an injured pelvic floor, but all the way up to labor or pre-labor, how do people prepare?
Yeah, totally. So I'll kind of like focus on the like prenatal stuff, like on all the pregnancy prep that we do. So I think like in general, when we see someone who's pregnant, we can treat them at any point in the pregnancy, depending on like what they're experiencing. Like oftentimes in the first trimester, when there's like a lot of retching and vomiting because they're just like feeling so ill, they might be experiencing pelvic floor dysfunction. They might get leakage or other things from that. And it just like is so humiliating because you're like, on the like you're like vomiting, you're like so uncomfortable and like so like nauseous, and then like you're leaking on top of it, and you're just like, what happened to my
Something's happening.
um and so we can help a little bit with that just to make sure that they've got some control from a pelvic floor perspective while they're feeling so icky. And then when we get into the second trimester, we start to notice that there's a hormone that increases to help us with joint laxity and ligament laxity, which like I always joke with my patients, like I would argue that that's a really good thing when we get into like the birth part of things. Like we would want things
Yes.
to be
Yeah.
mobile, baby to come out, right? But sometimes it does too good of a job and it can create some like joint hypermobility or just like laxity. And can cause like what's called SPD, which is like the pubic bone can or the pubic joint can get too like mobile and
Okay.
can cause what's called like lightning crotch. And it's like this like very
Mm-hmm.
strong pain in that area or like in their sacrum, which is like the low part of their back where it meets their pelvis. That could get really uncomfortable for folks. So we manage that. And then in the third trimester, we still can help with things like that if that's what they're experiencing. But then we kind of shift into more of this like labor preparation perspective.
Mm-hmm.
We talk about like some different positions that some people can get into. And so like it's not just like birthing flat on your back and like in stirrups and like what we call this lithotomy position. It can be a little bit more mobile, it can be more functional and upright. And there's certain ways that we can, what am I trying to say? Use our body mechanics to facilitate an easier birth. And so we help people find that hip range of motion or like spine range of motion so that they can find those positions with more ease. And then also tell them like what are going to be the positions that are going to be best for you based off of your birth plan. Because if you have an epidural, like you're going to be limited. You're not going to be able to do like a deep squat, right?
Right.
But you can be inside lying, or you can try like depending on how strong the epidural is. Like some doctors and some facilities feel comfortable with you being in like hands and knees, and in more of a supported position like that. So we can kind of give them all of these options. And then other things that we look at as well as like doing stretches to the pelvic floor, like manual stretches.
Mm-hmm.
There's a specific muscle in the pelvic floor that during labor can stretch 3 to 4 times its natural length, which is like, can you imagine your bicep being like 3 times its length?
Ew.
That's
Yeah.
amazing, but crazy.
Yes, that's the perspective that I have. I'm like, like I think at first when I first learned this stuff, I was like, holy shit, I'm never having kids. This sounds fucking terrible. And
No,
then
thank you.
and then I see so many people who've gone through this experience and have been able to recover so beautifully and are able to like go back and play professional beach volleyball or like go back and play like
Crazy.
whatever and just like do all this badass shit. And so I'm like, oh, this is really cool. The fact that our
Yeah.
body can like stretch to these ways that we would never imagine, and then within 6 weeks be able to like do the dang thing.
Yeah. It's
So
amazing.
yeah, but we can help facilitate that. I always joke with my patients, like, we're not recreating labor. Don't worry. I'm not like trying to like, we're not trying to do that, but we're trying to help create an experience for your brain to not make it so novel. Because when there's novelty and pain, we tend to guard away from it. But if there's some familiarity, we can kind of like, okay, I feel a little bit more comfortable. I can kind of surrender into this moment a little bit more easily. So, and then we also, if they have a birthing partner or like their husband or spouse or whatever, we bring them in and we put them to work and we teach them different things that they can be doing so that they're not sitting. Who was it? Is it Jason Kelsey who brought a fan to the birthing room for their?
I did not know this.
Yes.
She was like, it's gonna be really fine. You're a fan. And she
Oh
was
my
like
God.
using that fucking fan. It's like
Into this
beautiful.
room. Oh my God. You're out. Go.
That's hilarious.
Yeah.
I mean, yeah,
So
I had a birthing doula, and she was actually our very first guest on this podcast, so like several episodes ago. But we kind of flashbacked on, she was there in the moment, helping me through all these different positions, actually in the hospital when it came to time. But she also had kind of Ben help, who's my husband, help me get on all fours, right? Like in the bed before my epidural, though. So getting into all these different positions, and even though labor is active, um, it still like was prepping my body and like getting into different positions and like furthering the progress and stuff. And like I remember my birthing doula also gave me things to do beforehand, but now I'm blanking on it. But anyways, yeah, there's so many things out there that like if you reach out to your resources like you or anyone else, like doulas, whoever, like they're so important to do to just like prep your body because then you set yourself up for success.
yeah, totally.
I feel like I didn't have those resources or did I know about them. And so I went into a very traditional labor in a sense of I went in, I was in absolute extreme pain. Cooper was behind my right pelvic bone area. So like every time I was having contractions, he was stuck. And I don't know if that's exactly the right terminology. That's the way the doctor described it to me, but it was so extreme pain. And I was like, I've got a super high pain tolerance. I mean, I've played sports. I played on a broken ankle for 8 months. Didn't realize my tendons, ligaments were torn, but this was the most extreme pain I've ever felt. So I begged for the epidural. I was 5 centimeters when I got into the hospital. And from then on, it was pretty much like a back labor and then, progressive. And I think the more I chat with other women, the more I chat with people like you and the more resources I'm exposed to, I'm finding such different pathways. And I'm hopeful that if and when we're able to have our next baby, I hope things look much different. And you can't plan everything to a T. Things can go wrong and all of that. But I do hope that I'm able to explore myself more and explore all these different ways. So it's a different experience altogether. So I'm not just laying there. And I don't want to use the word submissive, but in a lot of ways, I mean, I was drugged up so much that they were having to flip me from side to side. I was in such pain. Cooper was in a pretty vulnerable spot. And so, like, birth to me is so traumatic. It took me probably 8 weeks to be able to talk about Cooper's labor. There was a lot of really intense stuff that I'm still working through clearly. But in the same note, I I think that I wish I knew more so it wasn't as traumatic. And I'm excited to do it again and hopefully rewrite the narrative because I had the most amazing pregnancy and I had the most, I mean, I loved every second of being pregnant. I felt like superwoman. It was the best accomplishment I can say I've done, is creating this human and him coming out and alive and all this, if that makes sense. But the actual birth and the actual day of labor is something that was so traumatic and I had no I guess no control over so many of those variables. I did perineal massages and I did very basic things that your very stereotypical OBGYN gives you and a piece of paper and sends you off 2 weeks before you're due kind of thing. But I wish I had access to people like you and had those conversations and was able to know that, those were an option. So I think what you're doing is amazing and I think you're so impactful and I hope those resources are out there for other women because it can completely change your relationship with birth and the process and what's leading up to it.
Yeah, totally. I have that conversation and like not necessarily like processing as like a therapist, but like I I miss when I have established care with someone in their pregnancy, we set up postpartum appointments as well, and I see them through a telehealth at 3 weeks
Yeah.
because I just ain't nobody coming to the clinic at 3 weeks postpartum. No one's asking me to leave the house.
Yeah.
We want to check in and see like how it went and what we can kind of process together, and then we can focus on this postpartum period. And you know, Peyton, your story is something that unfortunately I hear often. And it's something like, yes, there are things that are completely outside of your control. Like you could have done all of the things and may have had a similar result, right? And so
Yeah.
to take the responsibility off of you in that moment, I
Hmm.
think is really helpful because I think we do bear a lot of that on ourselves, especially like as the mother.
Yeah.
Then like when I'm teaching all of these different strategies, I'm telling them like this is only coming from like an ideal biomechanical model. There are so many other layers and contexts that are going to influence your care throughout this day or a couple of
Hmm.
days. right?
Mhm.
And we have to keep all of that in mind. And I get kind of frustrated when people are like, you should never do C-sections, or like you should never like do episiotomies. And like I'm not
Yeah.
thrilled about of what an episiotomy is. Like basically it's like when they cut part of your muscle. Um,
Yeah.
and it's like it's not I think it should be like a last ditch effort, but those like they are there for a reason, and there are contexts where it's probably going to be more appropriate to do that, and so there's no shame in the game, right? Like whatever way is going to like be best for you and be best for your baby is what I'm here to support. And really what I want to teach people is giving them all the options so that way they're informed in their care, and that they can have the choice and make the decision and feel empowered in that, as opposed to someone just telling them like, hey, this is what you need to do, and not really giving them any informed consent and not really giving them a reason as to why they need to do that. So that's kind of more of my intention, is just like, I'm going to give you as much information as possible so that you can make the decision that's going to be best for your family.
I,
Yeah.
I I resonate with that so much because in I don't want to make it about our birth, but essentially we had our birth plan. We wanted to do vaginal as long as everyone was safe. And we were only in the hospital about 3.5 hours, and the doctor on call was just like, okay, we need to do an emergency C-section because you haven't progressed in 4 hours. And it was something where Chase and I did a lot of research. We went through our birth plan. And I was like, well, can you give us the reasons why we need to do this emergency C-section? And it was kind of a little bit, well, you're not progressing fast enough. And we're like, well, fast enough against what model? Are you talking about with my body, with, the stereotypical, or are you just kind of trying to turn and burn the hotel or the hospital room essentially? And it was just, okay, every 3 hours, oh, emergency C-section. And it was kind of this pressure on me to like, okay, hurry up and get him out. But in the same note, is he in danger? Am I in danger? What's the risk? And where is this model we're looking at, this like emergency C-section? I mean, I've heard of women in labor 24, 36 hours after their water broke. There was no risk of infection. And like there's all these different stories, but why is the narrative an emergency C-section? And I think C-section is a massive abdominal surgery that should not be taken lightly. And if I'm able to push Cooper out vaginally without any risk to him, I'd like to go that option. But also, if the C-section is the best way to keep my child and myself safe, it's a massive surgery, and we need to take care of that and prioritize. And I think pelvic floor health needs to be recognized with both vaginal and C-section. And I'm sure you can speak more on that. And I'd love to open the floor on that, because I think people forget that C-section is not just, oh, take them out the sunroof kind of policy, or, oh, just slip them open, pull them out, it's easy. Oh, I mean, it's a massive abdominal surgery, and I think it needs to be highlighted and recognized, and it's not the easy way out, at least from the research I've done, and I'm sure you both can speak more on it, but
Oh yeah, we're getting onto some soapboxes I have for sure.
well, we're here, we're giving you the mic.
Let's hear it.
Yeah,
Yeah.
absolutely. I've had a couple patients that be like, I'm doing an elective C-section because I don't want my coochie to change. And I'm like, girl, you just housed a baby for 9 months. Do you think it's like not gonna do anything? So yeah, I mean, however way that baby comes out, we have to remember that we carried a child for 9 months, right? And like, I always make this joke. My partner, Kyle, what he told me when we started dating, he was like, I just want you to know that I was 11 months, or I was 11 months. I was 11 pounds at birth. And I was like, you need to come with us to funeral warning, sir. Like, tattooed on your forehead. Like, that is like, I'm very
Oh
glad
my
you
God.
got that information before I agreed to date you. But then in my mind, I was like, I'm 6 foot tall. I'm a pelvic floor therapist. Like, this is my moment.
You got this.
You
Yeah.
got this.
Challenge accepted.
But yeah, I mean, when we're thinking about like a vaginal birth, like, yes, those muscles are stretching, and there's also like some regeneration there. Like, our muscles don't just like stay there. They have this elasticity. They're able to come back and regain that function. Um, and then the uterus heals and all that kind of stuff. And so like you can see like some really like, it might not even look any different. So there's that. And then with C-section, like, yes, it's not coming out the vaginal canal, but you are cutting through layers of tissue, like muscles and your uterus and all of that. And then there's scar tissue that's coming involved, and how that scar tissue is connected to your pelvic floor and connected to other things. And so, yes, I see folks for pelvic floor therapy postpartum, whether you have a vaginal birth or whether you have a C-section. And both are major medical events and can be equally traumatic in either way. And I do not favor one over another. I do not shame one over another. Like they both are significant, and both need to be recovered or
That
rehabilitated.
makes sense. Yeah, I'm a personal trainer and like I kind of understand the body in the same way of like literally everything's just like interconnected. Like let's say there's an issue, you probably have a different like perspective a little bit too, but like if you have an issue with the front side of your shoulder, it might be impacting like or connected somehow to something that's going on in your backside and it's just like it's all kind of wonky. So never think that like one direct problem area is the only area that needs to be addressed or like that's going to be the only issue. So it's like, it's wild. The body is wild, but yeah.
I literally treated someone who was having urinary leakage, and when she was running, and we were doing all these things and like seeing a little bit of help, but like still having some leakage. And so I was like, did you have any like orthopedic injuries as a kid? Like kind of like going through her history. She's like, well, I did break my ankle and I have an ankle fusion. And I was like, okay, let's look at your ankle. And she had like no ankle mobility and she was missing a lot of strength. And so 2 sessions of treating her ankle and her urinary incontinence went away when she went running. And I was like, this is weird.
Right?
This is crazy. Wow.
Cool. And like,
Listen,
like it makes sense in my brain as to why, but it's like, yeah, we can't like, I'm not just like looking at your pelvis. I'm looking at the whole person and how that can be playing into their
Totally.
so crazy. You sound like a miracle worker, and it's so refreshing to just have like a different perspective. And also, we were chatting earlier just through like being heard and the fact that you're looking at this person and you're looking at her health and you're going, okay, we're doing all these exercises that should work if you're looking at the textbook. But instead of just dismissing her concerns and going, well, we tried all these things, you took a step back. You acknowledged her injury, you acknowledged what was happening, but then you looked deeper and you found this injury down on her foot. And I feel like in women in healthcare, and I'm not trying to be such a pessimistic, but I feel like women are so dismissed and pushed to the side and they don't get heard on these basic things, and that could completely change someone's life. And the fact that you heard her, and it sounds like many other women and also men, of course, in your practice, it just sounds like you're impacting people all the time. And it's such a privilege to be able to chat with you through all of this and hear what like the impacts you're doing.
Oh, you're so kind. I do not call myself a miracle worker by any means. If anything, like I am a guide and I am a resource for my patients, but like yes, we can do like some manual work here and there, but like it's like working out, right? Like if you're going to PT once a week, you're not doing anything in between, you're not going to see a whole lot of results. Like working out, like you can't just like work out once a week and then expect to have washboard abs. Um,
I wish.
to like put in,
Yep.
you're like the personal trainer's like, uh-huh.
I mean, that's a very true statement. Yes.
Yeah. And so my patients, are doing a lot of work in between their appointments and they're showing up for themselves and being present in their own bodies. And they are the ones doing the work. I'm just here to provide a guide and a resource for them to get on the journey.
Hmm.
And then for most like listeners, a majority of our listeners are of course women, and we have some men sprinkled in there. Hey guys, and like whoever else identifies in different ways. So, but like what? So we always hear Kegels, right? Or at least I did, and I was like Kegeling away and Kegel when you're at a stoplight and try to do this and that. Like always like do this nonstop. But what's maybe another very simple, easy thing that women or anyone else might be able to practice on their own for their pelvic health?
Yeah, you found another soapbox of mine.
The Kegels.
Yeah, I'm pretty anti-Kegel. And the reason why is there any moment in your life in which you needed to do a Kegel to perform a task?
Coming up from a squat, maybe a little bit.
Right. But okay, but to argue that like a Kegel is an isolated contraction, with a squat, you're at least like
The whole body.
in your whole body. Like I think there's like an EMG study that showed like squats and deadlifts when like performed under significant load are actually a better core exercise than like a bird dog or like any other like core exercise
Yes.
that we have. And so all of these muscles are co-contracting with the pelvic floor, and it's supposed to do that automatically, right? We shouldn't have to be like mindfully be like, you need to contract now. And so when we think about a Kegel, it's an isolated and it's a voluntary contraction. The pelvic floor is never performed in contraction, never performed in isolation. And it's also really rarely performed voluntarily. It's all involuntary. Like it should be happening without us thinking about it. And it should be happening in conjunction with other muscles contracting. So why would if I'm doing an exercise program for someone with pelvic floor dysfunction and they're having issues running, they're having issues taking care of their kid, they can't get out of a chair without leaking. Why would I give them just like laying down on their back or like sitting at a red light and just like having them squeeze those muscles when like I can get them up and off the chair and like practice the squat, and can we change the form, and can we look at your running form, can we look at like what your hip strength and what your core strengthening is, because the pelvic floor is attached to like other muscles and other joints. And so usually when other muscles and other systems are working in the way that we want it to, the pelvic floor should be working in harmony with all of that. So whenever people come in and say that they're doing Kegels, I immediately tell them to squat.
I'm glad I brought it up then.
Yeah, I get real spicy about it.
I like it. Bring the heat.
I will say I try to not ever say never. There have been some cases where I do think it can be appropriate, but for the majority of our patients, we're looking at it from a more functional and real life lens. And so like doing squats is probably going to be a great pelvic floor exercise for you. Doing deadlifts are probably going to be a great pelvic floor exercise for you. What I do,
double thumbs up from the trainer. Yes.
Oh girl, I
endorse.
Really like, and Peyton knows too, like we have a pretty like from like freshman year of high school, like always had strength training like as part of our regimen, and like I still actively strength train now. And people look at me in the gym and they're like, how did you like get to squat like 200 pounds? And I was like, I've literally been doing this for over half of my life.
Yeah.
100%. Yeah. Very long time.
Yeah. And that gets even into like a whole nother digression of like taking care of yourself through menopause and like perimenopause and making sure that you're actively strength training to help with bone density and all that kind of stuff.
Oh, we need to have you back on for another episode because we have so much more to talk about. Great. Okay.
Yeah. But yeah, and even like breathing, having people be mindful, like I have people visualize like what their pelvic floor is doing as they breathe. Because when you inhale, it should drop and relax a little bit. And then when you exhale,
all just sat there and did it.
Practice.
It should lift up. I literally have people place their hand on their vulva, and so they can feel that movement as they're breathing in and out. So like if you're going to do anything at a red light, take a couple of deep breaths.
And feel yourself. Yeah. Well, that dives into from a truck. I hope you don't have a short car. Well, that dives into maybe one of our final or second to last question, because we saw that you offer some sex coaching, right? So do you want to kind of sprinkle some information about that?
Yeah, so I do sex coaching. I started taking these courses when I really love working with folks who've had pain with intercourse and dysfunctional intercourse and things like that. And then what I was realizing is like I was getting them to a place where it was pain free, and it wasn't hurting anymore, which was great, but they were still like, it's fine. Like I don't need to have it. And I was like, what can we do to like advance this experience to help them like not just be pain free, but to have them have sex worth wanting.
Yeah.
And so it's been quite an interesting journey because it's through a accreditation area section called ASACT, which is like sex therapy, and like you're seeing a lot of psychologists and things like that. And so it's really challenging for me because I'm very analytical, and I'm like when I'm looking at the body, I'm looking at the joints and the ligaments, and like have this like very analytical space about it. But with the counseling and the coaching piece, it's like you have to really be in tune with your emotions and what's coming up with you in order for you to best guide your clients and patients. And so yeah, I mean, we have a lot of fun. We talk about like, you know, what safe touch can look like and how we can have pleasure, not just like with our genitals, but like with our whole body, and how do we perceive pleasure? How can we give that pleasure to ourselves before we ask a partner to give that to us? And
Yep.
also like decentering the penis, decentering any orgasm or ejaculation. Like, yes, those like are parts of sex, but they're
Mm-hmm.
not, like the end all be all. Like,
Yeah.
course is only a part of a sexual experience, and orgasm is only a part of a sexual experience. And what can we do to really like make it bigger than just that? And so kind of opening up people's minds.
Take the pressure off of that. Yeah,
Yeah.
I get that.
I love that. Oh, well, and I guess that kind of brings us into, and we kind of do this segment on our podcast called A Moment, and it's kind of just something where we recommend a product we're enjoying or finding to be really useful. And I think that this can go a lot of directions with you, but we were kind of chatting about, and I'd love for you to share a little bit more about how potentially lubricant or lube can help with not just pelvic floor health, but also just intimacy. And I'd love for you to share a little bit more about this specific product you're enjoying.
Yeah, so I'm a big fan of lube. We all want like it to be juicy down there, is what I like to say. A juicy vulva and juicy vagina is a healthy vagina. And whether I'm like doing, so part of like what I do in PT is like an internal vaginal exam, and so we use lubricant for that to help make it a more comfortable experience. Um, but also like everyone should be using lube with sex. Like it may just make everything so much better. But not all lube is the same. Like if you go to like a typical like KY thing, like there's just like parabens and glycerins, and it can increase your risk for infection. And like I would never get the stuff that has like the warming tingles or
Mm,
whatever. Like it's so bad for your microbiome and everything. And so you want to have a lubricant that doesn't have all of this added like shit in it, but can still enhance the experience. And so what I use in our clinic and what I recommend for most of my clients is something called slippery stuff. It's a water-based lubricant, but it's paraben-free, glycerin-free. And then what I also like about it is that a lot of lubricants are very runny, and like get messy, and then you have to like change the sheets and all this kind of stuff. This is more of like a gel. So when I have patients using like different like, for the lack of better words, like toys, like the like therapeutic toys,
Mm-hmm.
mhm.
use that gel and it actually like stays on the toy, as opposed to it like running down and getting slippery and messy. So it's kind of like no mess, water based, so you can use it with like all the things, and also doesn't have like icky stuff in there. So
Oh,
that is a product that
Good to know.
good to know. Thank you. We'll definitely link that in our show notes. And
Yeah.
big advocates for toys. So we had an episode about that a few weeks ago, and definitely trying to heighten the experience for everyone. I think it should be an enjoyable thing and something that, you look forward to and you don't dread or know what to expect. It should just be like a really great mutual like bonding experience. But that's another topic for another day.
Oh yeah, I feel like we can have many. I see many podcast topics in our future.
Oh,
Yes. Oh, yes.
oh, I hope you had a great time. We really appreciate you coming on, and I hope I can reach out to you again and have you on. And, next time I'll give you the topic of choice and you can, get on your soapbox because I find that the things that you're passionate about aligns quite well with Elena and I and what we want our listeners to be passionate about. And we want to be able to use, all the resources and help we can to help our listeners, but also like give you hopefully a platform to talk about things that you're passionate about. And we're really thankful for you coming on.
And
Yeah.
speaking of that, if you have, you obviously have your in-person location in Monterey, California, but do you take like virtual clients at all? Just so our listeners know.
Yeah, especially for like the sex counseling stuff. That can be as easily done through a virtual experience as it can in
Sweet.
person. And we do, as far as like virtual for like pelvic floor stuff, we'll do like coaching and counseling as well. And more of like a wellness as opposed to like true PT, because PT is like pretty hands-on. But we'd be able to like help kind of coach someone who, especially like if they don't have a pelvic floor therapist in their area, we're a rare breed. And so if you don't have that access, we'd be happy to help fill that gap.
Perfect. Well, do
Awesome.
you want to give us your website name and plug all your places for everyone to find
Yeah,
you? That
absolutely. You can find me on Instagram at Monterey Pelvic Health. And then my website is montereypelvichealth.com. And those are really the only two places you can find me. So yeah.
That sounds pretty perfect to us. Well, thank you
Love
so
it.
much.
Yeah, thank you.
Thank you. Yes, like we said, we'll have you back on in the future for sure. But today was amazing. So, yeah, thanks again. And it was great meeting you. And
Yeah.
we hope everyone listening enjoys.
Thank you, and we'll see you next week.
Bye.
Bye. Stopping. Thanks for joining us on this week's episode of Mom Meets World. If you enjoyed listening, please give us a like, subscribe, and find us on Instagram at Mom Meets World Pod.
Because sometimes you just need another mom to remind you that you're getting it right more than you're getting it wrong. See you next time.